One day there was a patient that came in, and we did an extraction on her tooth, in her mouth. So we removed the tooth, and she went home. And then a couple hours later, she called. She was in extreme pain. And we asked her if she had smoking, and in fact, she did. So she ended up having dry socket. And that's one of the effects that can happen when somebody smokes, right? For smokers. So that's what I want to talk about today. I want to talk about how smoking negatively affects your mouth. It can affect your gum tissue. It can also affect your teeth. So how does that happen? And what are some of the repercussions of actually smoking in your mouth? Okay, so number one, the way it happens. So what happens is smoking is going to decrease the blood flow towards your gum tissue, right? So it ends up being that your teeth or your gums rather feel like they're choking, and so you don't have enough oxygen that gets to your gum tissue, and also it causes your gum tissue to be more dry, right? Hence dry socket, but also dry mouth. So there are many things that can stem from those problems, right? You can end up having a mouth that is dry, as we said. And so a dry mouth can actually definitely lead to more cavities, because it is the hydration of the mouth that decreases, and especially the decrease of salivary flow. So you have less saliva in your mouth. That can also be, caused by the smoking effect in your mouth. And so now your teeth are more susceptible to bacteria that adhere on your teeth in easier. And so that being said, now they can actually eat on the food that they found in your mouth and create this byproduct acid that is going to actually start causing cavities, or deteriorating the enamel of your teeth, which is the outside surface of your teeth. Okay, and when it continues to progress, it can also affect the dentin, which is the part of the tooth that's on the white part of the teeth that you do see. So cigarette can lead to a cascade event that can end up leading to cavities. Okay, so if you don't want to have cavities, and you're a smoker, you want to consider smoking cessation. All right, another thing with the drying effect of the gum is that it can lead you to have gum disease. So as I was saying, your gums feel like they're choking. So now, they're pretty much like dying, right? So you can end up having gum recession. You can end up having some pockets between the tooth and the gum. And so that can progress, also inducing not only inflammation of the gum itself, but also inflammation of the tissue, which is the bone that's under your your teeth, and that's under your gum rather, and that supports your teeth. Okay, so you can end up developing periodontal disease, and smokers are really prone to periodontal disease. Another thing that can happen is that smoking can induce staining of your teeth, and in some instances also staining of your gums. Okay, so you can end up seeing like some yellowing of your teeth, or your teeth become more brown, and that can be caused by the effect of smoking. Okay, so if you're trying to have a white smile, yeah, you're smiling and it's aesthetically pleasing, you want your teeth to be white, and you're a smoker, consider ceasing also to smoke, because it's going to cause staining of your teeth. Okay, so that's another thing that can be caused by smoking. Number three, okay, is going to be bad breath. And smokers are very conscious about that, because I've seen many people who smoke, they're always carrying chewing gum, or mint around them, so that they can actually eat it really quickly before they go in public, before they go meet someone or something like that. So they're very conscious of the fact that smoking leads to halitosis or bad breath. Okay, so yes, when you chew on gum, you can mask the odor, but only for a little while, because it doesn't just come out of your mouth, but you yourself, we can tell that you have smoked. So there's that distinct smell, that we can find from smokers. Number 4, oral cancer. Okay, smokers are very, very prone to oral cancer that can be seen either, on your cheeks, your mouth, your lips, your throat. So it can lead to oral cancer, and it's especially if you drink on top of smoking, then the chances of you catching oral cancer also, increases. So that's another thing that you don't want to have, right? You don't want to end up having oral cancer. So those are some of the things that can be seen on smokers, okay? And that's the reason why we entice, or we really, really encourage our patient to consider stopping, this smoking habit. All right. So you may want to ask yourself, well, okay, so that's with, smoking, using an actual cigarette that you light up. How about chewing tobacco then? What are the risks? Is it more safe? Well, the answer is no. Even when you're chewing on tobacco, you can still have some issues. In fact, it can lead to, recession, gum recession. Also, your enamel is affected in that it can start eroding your teeth. So you have decreased enamel. You're more prone to sensitivity. It also causes staining, some type of staining. Yellowing, or your teeth become more brown. So no, you don't. And even oral cancer is also one of the smoking, even chewing tobacco is also one of the risk factors for that. Okay, you can also start having like white some whitening of your gum, or like it becomes more gray. And so those lesions, can be precancerous as well. So it can also lead to oral cancer. So those are some of the reasons why you don't want to consider chewing tobacco either. Okay. So that's what I wanted to talk to you about today. If you are a smoker and you have more questions, don't hesitate to contact us and call us. Once you're a smoker, you really definitely want to go to the dentist more often, so that your oral screening can be done on you, so we can see whether you are starting to develop oral cancer, and then we can direct you accordingly so that you can find treatment for your mouth. Okay, but the thing that we do encourage people to do is to stop smoking. Okay, and there are many ways that can be done. So don't forget to contact your doctor or your dentist, so as to have ways to actually stop smoking. Okay, so I'm Dr. Valerie Mukanga with Healing Wings Dental, the place where we help our patients maintain and regain their oral health and their smile, so they can soar in life. If you want to come and see us, you are in our area, Dallas-Fort Worth area, don't hesitate to contact us. You can give us a call at 972-213-0202. You can also go to our website, www.healingwingsdental.com, to request an appointment. And we are located on 4101 West Greenwood Boulevard, suite number 317 in Arlington, Texas, to be precise, and our zip code is 76016. We're here for you. We're rooting for you for your oral health. So with any questions that you have, please don't hesitate to contact us. Also, should you have found this information valuable for you and you want to share it, you do want to share it with friends and family, don't hesitate to do so. You can find us on our social media handles. Please subscribe to our channels, or like, comment. If you find something valuable, please let us know. If you have any questions, don't hesitate to ask your question to us, and we will address them accordingly. Okay, so that being said, wish you a great and fantastic rest of the day. Be blessed. Bye-bye.